there's never an always in medicine as far as I'm concerned. There was a ruling last year after a case was taken to court. It's known now as the Tracy decision, and it basically has led to both the GMC and the Resus Council and the BMA putting out guidance to suggest that patients should be given the opportunity to be involved in these discussions, and the only reason for a doctor not discussing DNA CPR, if it's appropriate discussion with that patient, if they think that the distress caused will lead to significant harm. And the difference to prior to the Tracy discussion is that doctors had the ability to say that the discussion would be too distressing, but not that the difference now is that distress would lead to harm. In other words, they are acknowledging that the discussion is going to be distressing to virtually everybody, but that's normal and natural. Over and above that normal and natural distress, would there be actual harm done to that patient by the level of distress? You can't force a patient to talk about what their health needs are for the future. And I think there are, as we know, going to be several patients who will not and do not want to discuss this. And what I would suggest you do in those scenarios is to actually try and persuade the patient that if they don't want to talk about it, would you have permission, their consent to talk to their next of kin about it? Because I think it is important that people who are involved with that patient, whether it's the healthcare professionals or the relative next of kin or carers, have some idea of what the best interests of that person would be before a crisis develops.